Welcome to this segment of my educational series on prosthetics, orthotics, and amputee rehabilitation. My name is Dr. Heikki Uustal. I'm a specialist in rehabilitation medicine, and I hope this is an educational and enjoyable video. Thank you. So, welcome back. It's Dr. Uustal. In this segment today, we're going to talk a little bit about the timeline of when a patient gets fitted with their first prosthesis, and then how they progress through the training process and eventually into their second prosthesis, and then a little bit about lifetime care. So let's go through each part of that one step at a time. From the day of amputation till the time you get your first prosthesis typically is about 4 to 6 weeks if all things go well. That's called the pre-prosthetic phase, meaning before prosthesis. What should be happening, you should be getting some kind of attention regarding wound care, what to apply onto the surgical site. There should be some compression of the amputation limb, we'll call the residual limb, and that's typically done with an ACE wrap in a figure 8 pattern. I have another segment we've already posted about figure 8 ACE wrapping. And in addition, there should be a physical therapy program that goes along with it. During this pre-prosthetic time, it's very common for patients to actually get weaker and to get stiffer at certain places, particularly at their hip and at their knee, because they're sitting for several weeks, even a month or more. So physical therapy for stretching, for strengthening, for cardiopulmonary endurance, occupational therapy for working on the arms and resuming self-care activities. All of that is part of the pre-prosthetic program. So what about the amputation limb itself? It's oftentimes tender or painful in the very beginning, so desensitizing that with gentle tapping, rubbing, or massaging will help some. Having that ACE wrap on there will also help, because if the leg swells up, it's actually going to hurt more and it's going to heal slower. If people tell you the ACE wrap is dangerous, then the answer is no. A gentle ACE wrap with compression on the amputation limb actually makes it feel better, less pain, and actually will help to heal it faster. Now, most patients will have stitches or staples in their surgical site, and those are a little bit tricky because you can't pull an elastic shrinker sock over those staples. So the ACE wrapping is done in the beginning for the first several weeks until those staples come out, but then once they're out and once the surgical site is healed, then we can go to a shrinker sock that looks something like this. For below the knee amputation, it'll look similar to this, comes in different sizes. For above the knee amputation, it'll also have a waistband that will hold it in place. So it's important to have some gentle compression on your amputation limb for the 23 hours a day for that first month or two when you're first preparing for the prosthesis and then when you get the prosthesis. So let's say we got through that first 4 to 6 weeks. Your limb shaping is good, where it's not wide at the bottom, it's in fact a cylinder shape or even a tapered shape where it gets smaller at the bottom. The surgery is well healed. Now we're ready to move on to that first preliminary prosthesis. And that first prosthesis will typically be fairly simple, kind of like a starter leg that we would use to get walking. And that's really preparation to see how well you're going to do with any prosthesis to prepare for your second, more permanent prosthesis, which may come several months down the road. The first prosthesis you get will essentially have 3 parts. If your amputation is below the knee, you'll have a socket, it'll have a connector piece we'll call a pylon, and it will have a foot. The foot itself is determined based on your activity. At least for a starter, most people will get a foot that has a little bit of motion, and we'll have a whole nother segment on prosthetic feet. But you'll get a starter foot that has a little bit of movement but allows you to walk primarily on level surfaces. Oftentimes we don't cover it, so we can make adjustments to the metal connectors here, because sometimes the alignment of the socket and the foot are critical. Now, once you get your first prosthesis, typically you will need 4 to 8 weeks of training time in physical therapy, in outpatient therapy 3 times a week for about 2 months, or up to 3 months or longer if your amputation is above the knee. And during that training time, you'll learn how much time to wear the prosthesis, typically starting only 1 hour a day, building up to all day long, but you never sleep with the prosthesis, remember. And you'll basically get instruction on how to walk with the prosthesis. You may start with a walker and then progress to crutches and then a cane and then hopefully nothing at all. getting you back to the level of walking you were at before. That's always the functional goal, is to return your mobility to close to or at what you were before. Now, once you've learned the basic skills of walking with the preliminary prosthesis, then we'll move on to the second prosthesis. But a few things happen in between along the way. During the fitting of this first leg, till 3 to 6 months later when we fit the second, more permanent prosthesis, typically your limb shape will shrink down. So you will also need to learn a little bit about sock management. We're going to give you a collection of socks that you will apply, thinner socks, thicker socks, that will accommodate for the shape that you've lost to keep the sock in a nice snug fit. Once you kind of reach a point where you've hit a plateau, you've done as well as you can with the starter leg, and your limb shape has shrunk down, then we'll move on to the second, more permanent prosthesis. And two things may be different about the permanent prosthesis. Number one, there may be fancier parts to it. We may now be talking about carbon fiber or fiberglass feet that have a little bit more bounce or spring to it. There may be a change in the socket design, in how we connect you to the prosthesis. But even more importantly, there may be a cover on there that hides all the stuff inside. Now, all the stuff is still there, it's just covered over with a foam and then a nylon or rubberized skin on top. Now, all of these are suitable to put on a shoe and a sock. So you can have the matching shoe and sock, whatever you'd wear on the opposite side. But remember, if you lost your limb because of diabetes, you should be protecting the other foot anyway. So having a specialized diabetic shoe with a custom insert may be critical, and that's important to also have during this phase, because once you start to walk with a prosthesis, you're likely still going to be putting more pressure on your remaining good leg compared to the prosthesis. So we want to protect that remaining leg. Even when you get to the permanent prosthesis, you're going to still want to make sure you're protecting that remaining leg, because diabetes does not go away after you have a single limb amputation. Now, we call the second leg a permanent prosthesis, but typically it will last 3 to 5 years before it requires replacement. Along the way, there may require adjustments to the socket or adjustments to the alignment, the angle of the leg. You may require replacement of certain supplies like socks that go inside, or even the foam cover on the outside. And there are some patients that have dramatic changes of volume even after they get into their permanent prosthesis, in which case the top piece, the socket, may need to be replaced, whereas the rest of the parts can be saved or salvaged and continued for use. After 5 years, most of these parts are out of warranty and have significant wear and tear, and it's time to just replace the whole thing and start over. Each time a new prosthesis is made, whether it's the first one or your permanent one, there's a casting or molding that's done of your leg. It's done with a plaster wrap or some kind of a sleeve. Sometimes it's done with an electronic scanner that captures the shape of your amputation limb and duplicates it. And from there we can make a mold and build the socket. The socket is the part that's the custom-made piece on top that matches and fits the shape of your leg. Most of the other parts are purchased from outside manufacturers. So there's a lot that goes into the process of thinking about how do we design each leg, both the starter leg and the permanent prosthesis. And in future segments, we're going to talk a little more detail about the socket design and about components like the feet. Thank you.